We've seen in the US the weaponisation and politicisation of mask wearing. In Australia, politician Craig Kelly has raised questions about COVID treatments, including the use of hydroxychloroquine. Media personalities such as Pete Evans have raised questions about the efficacy of COVID vaccinations and vaccination programs more broadly. So my question to the panel is, in such a politically charged environment, what can be done to reach people who oppose the vaccination program, especially given that many anti-vaxxers are well educated and use research to justify their opposition?
Tony.
That's a big question. It's a difficult one. I agree with Nick here that you've got to do the education so that people come along with you. The Kellys of this world, thankfully in Australia, that's a very small part of our political pie, as it were. So at least we've got that position of strength there. I think countries like Australia, a bit more of a social democracy, have done better at not politicising the wearing of masks. See the way New South Wales took it up so quickly. So I don't think we've got as much of a problem there on the politicisation of it. As far as reaching out to anti-vaxxers, that's challenging. My approach to that is that you've got to be straight up. You've got to present those results from the international trials that show the side effects are low. But you also have to be open to the possibility that there will occasionally be side effects and sometimes serious side effects, and be honest about that and thoroughly investigate incidences when they happen. So just finishing up there, you know, it will happen that 10 days after somebody's vaccinated, they'll get an autoimmune disease or something like that, and there'll immediately be questions. In all likelihood, they were going to get it anyway. But you still need to take that seriously, investigate it, and then look for the evidence from all the trials across the world. That's how I would approach it.
Sharon Lewin, how troubled have you... I just want to gauge how troubled you've been about the promotion or by the promotion of hydroxychloroquine.
Yeah, I mean, you're just talking about the problems with misinformation and trying to, you know, digest selective digestion of what's out there and making a very strong conclusion about the treatment. Well, Craig Kelly can't prescribe hydroxychloroquine, and you won't get a single doctor around the country that's going to do it, but it does spread misinformation and promote fixed beliefs. And I think we've got to, the government's got to put out clear and consistent communication, doctors and scientists do, but I really think for vaccination we need to embrace community leaders and people that can really influence and speak the same language as the very diverse group that we want to vaccinate.
And
I
just
think
today,
that's going to be very
in the JAMA or New England Journal of Medicine, hydroxychloroquine, randomised trial, multiple countries around the world, no effect.
Yeah.
So what's the answer, though, when you have a public figure, like an elected politician, that's spruiking this stuff?
I think I just said it. No effect. Trials all around the world. And that's what the message we need to get out there.
But that's not going to shut up some people, and they have big platforms.
There'll always be the 1%
Yeah.
like that,
Yeah.
and it's important that they see that 99% of us read the journals or convey that message, and the science says this: no effect of hydroxychloroquine.
Michelle, I think you were trying to get...
Yeah, I think these are great questions, and I think it's normal to be hesitant about vaccination, particularly for adults. It's different for littlies, right? We just make our kids do it and they don't have a choice. So what I would say, though, is just turn it around a little bit and say that delaying vaccination or avoiding vaccination could come with a heavy cost, right? It could come with a heavy cost to you, to your inner circle, whoever that is, and to the wider community. And, you know, there are statistics around that, there are stories around that, there are narratives. So, you know, you need to make a decision and weigh up what is actually in your interest and in the interest of your family, because often it's the emotional context that will motivate adults to do something. For example, if you were to come home and inadvertently infect your parents or your children or your spouse or partner, and they ended up in hospital on a ventilator or they died, you know, you would feel the guilt, right, of that. And I think that that is not to be underestimated, because that's suffering as well. Even though you didn't get sick, you might have, you know, breezed through COVID, but someone else has taken a hit.
Dr. Coatsworth, how do you get that message through to Paleo Pete?
Well, you don't. I mean, honestly, I think...
You just give up on speaking to him?
I think you have to, because there are a certain group who are promoting this message who, it doesn't matter how many times I talk to them, they're not going to change. So what we have to do through shows like this, through the government advertising campaign, through direct conversation, is find the people who are seeking their information from Paleo Pete and divert them or bring them into the credible conversations, the credible news sources that we're putting out through health.gov.au. But also it's going to be word of mouth. It's going to be the successful vaccination rollout. It's going to be demonstrations of safety and effectiveness in our own community. That will build momentum of itself as well.
You're not going to get an invite on his podcast after saying all of that. No. Now, we've sort of started to stray into this territory now of vaccine hesitancy, not quite anti-vaxxers, and there is quite a bit of data out on this, but we've polled our studio audience tonight. The majority of you have responded. It is anonymous, though, I should say. Here's the results. So we've split you up into those that are going to take it immediately, want it straight away, those that say you won't get it at all, tiny fraction of you, 2%, and then 15% of you that say you are hesitant about this. You might wait a bit longer until you know more. That's actually better than some of the public polling on this sort of stuff. But we've got Jasper Kitschke in the audience tonight. You've got someone in your life that sounds like they're vaccine hesitant. Who is it and what are they saying?
So I was chatting to my mum the other day on the phone and she expressed that she was a little bit hesitant about the vaccine, especially for someone in her age group as well. She's in her early 60s.
And did she explain why? Did she tell you where she's getting her information from?
I think, Mum watches the ABC, you know, she reads a lot of the papers and she's up to date with the news, but I think it's just the sheer volume of news out there that it made it sort of, you know, quite difficult, not to kind of have a bit of concern.
So confusion more than being opposed to the idea of it?
Yeah, more this idea of kind of waiting to see,
yeah.
Instead of the idea of, maybe being like a bit of a fence sitter for the moment. Which I imagine are a lot of people as well.
So I do want to get the panel's take, but did you try convincing your mum, or did you?
Yeah, I told my mum that I'd get the vaccine when it's available to me, instead of trying to reassure her that way.
Yeah.
Did
it work?
Well, I'd hope so. I guess we'll have to wait and see.
I hope Mum's watching tonight. Sharon Lewin, what do you do for Jasper's mum? How do you get someone across the line? Because clearly pretty well educated, engaged with the information that Nick is saying is key, yet still not convinced.
Well, I think number one, and Michelle alluded to this before, is recognising the concerns. It's entirely reasonable to have a bit of concern because this has all happened so fast, and in a year we've gone from a new virus to a vaccine, and so recognising the concerns is really important. Second, I think the benefits of the vaccine to her are really important to emphasise. So people often do care what the benefits are going to be to her. Benefits to other people are also really important. And I think many vaccine hesitant people really change with more information and also trusted advice. So from friends of hers, I mean, she may think, well, because you're much younger, it will be fine. But, speaking to her friends can have a big impact, speaking to her doctor, who she might trust. And with a bit more time, she may feel very differently about that. And I just want to say about your poll is very interesting because the figures you got from this room are almost exactly of the figures of vaccine hesitancy more broadly for all vaccines. But interestingly, about 15% and about 2 or 3% that will never have vaccines, but the recent polls that have been in Australia have shown vaccine hesitancy of about 40%. So it's actually a much bigger number than what we're seeing here.
To speak to your point, Jasper, I can tell you what happened to me last week. My daughter came home from school and she was crook. She had a runny nose, sore throat, and she was feverish. And I swear, I just sat there and I thought, oh my God, she has COVID, because there's no flu, so it's got to be COVID. And, we cancelled dinner plans. We got in the car and we got ourselves swabbed in the drive-thru. It was amazing. The whole experience was phenomenal. Thank you, Monash, Wellington Road Screening Clinic. And essentially, we had about 24, 48 hours of anxiety, right, in the house. And I was actually thinking to myself, I would have really liked that extra layer of protection, knowing that I had antibodies, meant that I wasn't going to get sick. I wasn't going to pass this on to anyone else in my family. And so, it just sort of brought it home to me that when I'm offered a vaccine, I'm going to be taking the vaccine. As long as it is TGA approved, that's fine with me because that is peace of mind.
So what I just want to understand, though, and help our audience understand, Tony, is whether these proportions allow us as a country to get on top of this. Because Sharon's saying that the target is not herd immunity, it's to avoid hospitalisation, avoid deaths. If these numbers that we saw here and are reflected in other polling were borne out in the rollout of this vaccine, would that solve our problem?
Yeah, so that's a herd immunity question. I'll come back to that briefly. Jasper, I get it. You're injecting something into your body that's doing something inside your body. It is a bit odd. And for the 15% of the population who don't want to do that, and immediately seeing how the rest of the population does it, learning from that, and then Sharon's point, that there's not only a benefit to you or to your mum, but also to the people around her, and those people will start to come on over. Which comes back to the point that you're raising, Hamish, about people coming on over. And that speaks to herd immunity. So whilst the government's goal is to try and stop people getting sick, what we really want is herd immunity. And we may or may not get to it. I'm actually more confident.
So they want it, they're just not saying that?
Sorry?
They want it, they're just not saying that?
Of course we want it.
Oh, no, I think the short-term goal is to protect and reduce death, but the long-term goal is to reduce transmission, and you do that through herd immunity.
And so with the AstraZeneca, it's reducing the chance that I will get it by about 50%. Now, the Moderna, which is a bit like the Pfizer, about 70% when you do the numbers. I won't explain exactly how it works here. But that's just a chance that I'll get it from you if you've got it and you're not vaccinated. But if you've been vaccinated and unfortunate enough to get infected, the duration that you're infected for and your infectivity will go down. And those numbers of total blocking of the transmission will go up. I believe go up in quite a virtuous cycle, so that herd immunity, I think, is still game on. Can't guarantee it. Don't want to have that come back at me in 6 months if we don't get there. But I think we can get there. But it does require Jasper's mum and at least, let's say, 75% of the population to be vaccinated to give us a good chance.